So we have Professor Stamatopoulos. Kostas, we were told of yesterday twice, calling you Prof.
Kostas is
it is Kostas.
For cosmetic purposes. Christina will give the talk. Hi.
And Christina Karamanidou, who is a leading psychologist in the Research Institute of CERS and Applied Science. And if I could hand over to, and also, I mustn't forget our esteemed Lorna. Where is Lorna? Here you are. So basically, I will allow, I believe, Christina, you have done a nice little presentation that is highlighting on a collaboration that the three network umbrella organizations, that's CERS, the clinical umbrella organization, Lymphoma Coalition, and CLLAN are collaborating on an initiative to explore treatment decision-making, if I'm right. Yeah? There's your clicker.
Thank you.
I'm going to get out your way. And obviously, Lorna is part of the shared session, so I'll jump down there with her so that you've got the space to give your talk.
Thank you very much, Nick, for the introduction, and thank you all for inviting us to talk a little bit about our next new project, our collaborative project, which we are very excited about. It's called Treatment Compass, and the name is not random at all. It is meant to be assessing treatment preferences of CLL patients and exploring factors that drive decision-making. What we have discovered is that there are no surveys around that particularly target this aspect of decision-making and therapeutic choices. And the reason why is that patient preferences change over time, and they change because the therapies have different characteristics, or there are new therapies coming out in the market, and that means that new problems come up, new side effects come up, or new treatment outcomes are available. And treatment outcomes used to be the main concern of patients, but now we've got quality of life aspects that were equally important to patients, like the rate of infections or treatment administration, and of course how side effects are affecting everyday life, for example, fatigue. Sorry. The other thing that is different is, of course, healthcare, and healthcare is delivered in a completely different way. Patients are completely different as well. Patients are what we call health literate. It means that they know more about the treatments, they know more about the disease, they have read, they are in contact with support groups, and this means that the healthcare processes, the interaction with the physician is completely different. Patients are more empowered, and this power differential has changed irrevocably. And healthcare is becoming, for that reason, more patient-centric, which means it is centered around the patients and the needs of the patients. And this is exactly what we want to discover. So patients do have a role to play, and for this reason, Eric And the CLL Advocates Network and Lymphoma Coalition have formed a collaboration. And this collaboration is meant to come up with a survey that is completely new and assesses in a different way the areas that we have just touched upon. For now, the countries that are taking part are all the English-speaking countries. So from Europe, we have got UK, Ireland. Greek is a plus because Kostas and myself can translate to Greek. France is one of our next goals. And from the entire world, we've got Canada and Australia. And this is what we call a soft launch. So it is the first wave. In the second wave, we will have many more countries. The methodology of getting there, I won't bore you with it. I'll just pass through it. What we've done first is focus groups with the patients, just to get a feel of how the treatment processes take place, how decisions are made, and what they prefer, what are the obstacles, what are their needs, and so on. And we allowed also for information to come up, information that we hadn't thought about. For example, some unmet needs that we think of in the beginning. Then we got a panel of experts that was made up of behavioral scientists, clinical and health psychologists, to develop a first version of questionnaires. And the reason for this is that psychologists are just very good at making questionnaires and giving them out to people. We know how to phrase questions and phrase questions not in a leading way. And this means that we had a long list of questions to give to the panel of medical experts. So the panel of medical experts, which were all hematologists, commented on the second version of the questionnaire. And then we had, of course, a panel of patients and patient advocates who are commenting on the third version of the questionnaire. And this is really where we are at the moment. The questionnaire has been put in a user-friendly environment, which means that the look and feel of the screen is just nice to look at. It's friendly for any user to use. And we are performing checks at the moment. So, for example, if somebody has had treatment, goes to another section of the questionnaire. If somebody is still in active monitoring, goes to another section of the questionnaire. So we're really testing the questionnaire at the moment. The final version of the questionnaire will be launched in a couple of weeks, hopefully, from now. And then we have to disseminate to local and larger patient groups. So the survey will be ready to launch. All of you will be notified. We are counting on you to spread the word. Local and international groups. And just remember that this is the first wave, and we are coming with the second wave with other languages. I think we will need your help with the new languages, and just bear with us. We'll be with you very soon. Thank you.